Well, good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your day. We are just a few short moments away from hearing from multiple UAB doctors regarding the COVID-19 vaccine and how it relates to women's health, specifically pregnancy, breastfeeding, and infertility. There are a lot of questions surrounding this topic. I do want to address the screen to your right of your screen. Right there, that is the live COVID-19 dashboard, courtesy of the Alabama Department of Public Health, where you can find all the latest numbers. We had roughly 3,800 new cases of COVID-19 in just the past day in the state of Alabama. That is according to ADPH. It appears that the press conference is getting underway, so we will send you there live now.
39 unvaccinated pregnant women to the hospital. Of those, 10 have been admitted to the ICUs. And of those 10, 7 are currently on ventilators. And Savannah, if you want to kind of show that graphic real quick. So just reiterating those numbers that we are seeing right now with unvaccinated pregnant women at UAB. And we will include this graphic for y'all as well with the recording afterwards. All right, thank you, Savannah. So today joining us, we have Dr. Audra Williams. She's an assistant professor in UAB's obstetrics and gynecology. We have Dr. Jody Dion, and she is the associate director of UAB's global health in the Center for Women's Reproductive Health and associate professor in UAB's Division of Infectious Diseases. And then we have Dr. Jessica Grayson. She's a assistant professor in UAB's Department of Otolaryngology, And she's going to be here to provide her personal experience with receiving the vaccine during her pregnancy. So to begin, Dr. Williams, I believe you had a few opening remarks you'd like to make.
Yes, and thank you for kind of setting the stage with where we currently are as far as our pregnant patients and specifically our unvaccinated pregnant patients here at UAB. We've seen a very striking increase in our number of pregnant patients that have been hospitalized over the past few weeks, as well as our patients that are requiring ICU care. And one of the things I really want to highlight today is that there has been a change over the past week in the recommendation for vaccination for pregnant women. So the CDC, along with every single major health organization for women's health, ACOG, the Organization for General OBGYNs, the Organization for High Risk OBGYNs, the Organization for Fertility Specialists, all are now strongly recommending that pregnant women are vaccinated. Previously, the recommendation was that the vaccine should be offered to all pregnant women, as well as breastfeeding women and women that are contemplating pregnancy. But now with the newer data that we have that is giving us more reassurance that this vaccine is safe, that there are no differences in pregnancy outcomes between women that are vaccinated or unvaccinated, that there is not an increased risk of miscarriage, regardless of which trimester the patient receives the vaccine, and that we are seeing more and more severe COVID disease in our pregnant patients. The benefits of the vaccine have been shown to outweigh the risk. And so we are strongly recommending that all of our pregnant patients across Alabama consider getting vaccinated to protect themselves and their babies.
All right, thank you, Dr. Williams. For those on the call, just as a reminder, if you have a question, you can drop it in the chat, or you can use the raise hand function, and we will begin taking questions. And if you're not speaking, please make sure you're on mute. So to begin with, Dr. Williams, I know you kind of already talked about this, but can you kind of just tell us what y'all are seeing right now with pregnant women, especially those coming in with COVID? Just give us an overall of what you're seeing.
Yeah, I think what's been most striking over the past few weeks is just the large increase in numbers and the number of positive patients. So in the OB world, we kind of have a unique opportunity to keep track of those numbers because we have been testing every patient that comes in through our maternity triage unit, which is basically our emergency room for pregnant women. And over the course of the past 2 weeks, our positivity rate for those tests that have been sent from that unit are coming back 50% positive. So we know that there's extremely high community spread of COVID-19 in our region right now. And of our patients that are admitted to the hospital, whether they're being admitted while they're still pregnant, for labor and delivery, or those that are postpartum, 25% of those patients are currently COVID positive. So we are just seeing numbers that we have not previously seen during this pandemic of rates of pregnant women that are being affected. And we're seeing those impacts trickle over into patients that are requiring those higher levels of care in the ICU, requiring ventilatory support. And unfortunately, unfortunately, some of these women require preterm delivery in order to maximize the chances for survival for both the mother and the baby. And there was a recent study that came out of California that did show an almost 60% increased risk of a preterm birth in women that are infected with COVID-19. So we're seeing that more severe disease. We're seeing those pregnancy outcomes, C-sections that are required. But we're also seeing the impact on patients that are not COVID positive, because we do have such high rates of patients requiring higher levels of care. We are really stretched thin as far as our staffing goes. So our labor and delivery nurses are having to go over to care for those patients and monitor the fetal well-being one-on-one. And so that leaves us less nurses to take care of our patients that are just coming in for routine labor and delivery care. So we've seen inductions be delayed and just a lot of strain on our staff. So it's affecting our whole community as far as our care for our pregnant women goes.
All right, thank you. Miranda, would you like to unmute yourself and ask your question?
Sure, yeah. Thank you so much. Well, to continue the conversation about pregnant women first, because I have other questions about non-pregnant women and babies, but for pregnant women first, we often talk about pregnant women and the vaccine after so many weeks, but what about early pregnancies? And should a woman wait, a certain amount of weeks after finding out that they're pregnant before getting the vaccine?
Yeah, so the recommendation does not change regardless of which trimester a patient is in. And there have been studies that have specifically looked at patients that were vaccinated before 20 weeks, and they did not show any adverse outcomes, no changes in the miscarriage rate. So when they followed those patients out and looked at the miscarriage rate, it was no different at about between 13 and 15% in the vaccinated population versus the unvaccinated population. So at any point during pregnancy, or even when a woman is contemplating getting pregnant, is a good time to get the vaccine.
And then Miranda, did you have a follow-up question?
Not for pregnancy. I'll give the stage to someone else and follow up with a question about non-pregnant and babies later. Thank you.
All right, thank you. Lauren, would you like to ask your question?
Yes, thank you. For the women you're seeing who are hospitalized in an ICU who are pregnant right now, what has been the impact you're seeing on the babies?
So those women are under continuous fetal monitoring, particularly ones that are ventilated. And if a mom is not oxygenating her body well, then she's not oxygenating the baby well either. And so we do see some of those impacts, and that is what sometimes requires us to go ahead and deliver the baby, even though they may be preterm, 30 weeks, 34 weeks. But in order to kind of optimize mom's health and baby's health, we have to go ahead and deliver them.
And what are the risks associated with that?
So there are lots of risks associated with prematurity. There are risk of, long-term neurological complications, long-term GI system complications that are well documented as far as risk of prematurity that are even higher kind of the earlier you get in a pregnancy. And so it's not just the acute risk of, the COVID infection that these babies are potentially facing, but long-term lifetime risk of being delivered early.
Can I ask one more follow-up?
Go ahead, Lauren.
Have you seen any loss of life, whether it be a pregnant woman or their baby, because of COVID-19?
Yes, we have.
Can you tell us about those situations?
I'm going to defer to our other folks.
Hi, Lauren.
It's Savannah. I think that we can follow up with you specifically and see if there are any patients or their families who may be willing to share their story. But we'll circle back with you about that afterwards.
All right, now we're going to switch a little bit. And Dr. Grayson, can you kind of talk about your experience with your pregnancy and kind of why you chose to get the vaccine and how it was throughout your pregnancy, and then now since you have after your pregnancy?
Yeah, so when COVID became a thing, I was not pregnant, and so was in the planning stages of pregnancy, and then became pregnant in the fall of 2020. And I was very concerned about my own personal exposure, both at work, because I do a lot of aerosol generating procedures, both in my clinic and in the operating room. And also because I have a school-age child at home and the potential exposures that they would bring into my house and the risk that that would mean for me being pregnant and for the baby. And so I was really excited when the vaccine came on to the block and they were talking about it with the FDA hearings. I tuned in, I watched all the FDA hearings so I could see if this was going to be an option for me. And I was pretty upset that pregnant women weren't involved in the original studies, but obviously that makes sense. Pregnant women are not often in phase 1 and phase 2 studies, especially not for things like this. And so I watched the FDA hearing to find out if there were any women who ended up being pregnant once they were in the trial, which there were. There were about 23 or so that were in the Pfizer trial that were found to be pregnant during the course of the trial itself. And so I was hopeful that I'd be able to get the vaccine based on the data that they presented at that EUA hearing. And I was very lucky that UAB took a stance of not refusing the vaccine to pregnant patients if they so wanted it. And so I got my first Pfizer vaccine on December the 18th. I was 21 weeks pregnant. And I was really excited. I got to be honest. I was just really excited to have an opportunity to keep myself and my baby safe. I went into that whole process deciding both as a mom and as a physician because I did not want to put my unborn baby at risk. I did not want to leave my unborn child without a mother. I did not want to leave my preschooler without a mom because of getting COVID. I didn't want my preschooler to carry with them any guilt about potentially giving COVID to mom if they got it while at school. And so this was the best decision to keep my entire family safe. After the first vaccine, I had a sore arm, but I still did my CrossFit workout the next day. I felt fine. I got my second vaccine at 24 weeks. So this would have been in early January. And same arm. I had a little bit of a headache the next day, but that was really about it. I registered with VAERS and the CDC and VSafe so that they could follow my experience. And I actually still fill out VSafe questionnaires because they're following the baby and me beyond delivery. The rest of my pregnancy was completely within normal limits. I didn't have any issues, no hypertension, no issues with prematurity, no concerns at all. I had a spontaneous delivery in April with no complications. I was, tested for COVID at the time of arrival in the MEU. I was negative. I did a CDC study throughout pregnancy. I was actually tested for COVID weekly as part of a CDC study in pregnancy. I never was diagnosed with COVID. My hospital stay was great. My child is growing normally. He's 4 months old. He's hit every milestone. He's happier than my other kid at baseline. But I don't think that's vaccine related. That just happens to be his personality. And I'm so grateful that I did this. I didn't have to labor by myself. My husband was vaccinated before I went into labor. My parents were vaccinated before. So everyone who entered my home with the new baby had been vaccinated. And so really, it was like a sigh of relief for me to know that I was safe and everyone who was going to come into my house was safe. It was also nice that my child will have my IgG antibodies from transplacental transfer. And I'm also breastfeeding. And so any potential surface mucosal antibodies from IgA that can further protect him until they have a vaccine available for young children.
Thank you, Dr. Grayson. My next question is from Morgan, and I think this one's probably going to be the best for Dr. Dion. Any idea why pregnant women are more impacted during the surge of infections than previous one? Is this the Delta variant and the higher viral load?
It is, yeah. So Morgan, what I was just thinking during all this discussion is what we're seeing is the Delta variant. We know that this variant is twice as infectious with much higher viral loads, as you mentioned. The reason why so many people in our hospital now and in the ICUs are under 65 is because most people above 65 have already received vaccine. It's very different than last December when most of the people in the hospital were in the older age categories. Because younger people have lower vaccination rates and because Alabama has lower vaccination rates, we're seeing our ICUs full, not just of pregnant women, obviously, but of other non-pregnant women and young adults, many with no comorbidities at all. The Delta variant really changes the pace of this game. It changes the pace because it's so incredibly infectious, 2 to 3 times more infectious than the previous variants were. We have to take it very seriously.
Thank you. Alan, would you like to ask your question?
Yes, thank you. Not be it Dr. Dion or anyone. First off, vaccine hesitancy. How great is it among pregnant women? And to get over that, would full authorization, Pfizer's up first, how much of a difference would that make? And sort of a third part of that, why is it taking so long to get full authorization to put that as another tool in fighting this? So that part, and then I have a monoclonal question for you after that.
You want me to take that one?
Yeah,
I can speak to, good.
Oh,
I was going to say, I could speak to just the vaccine hesitancy among pregnant patients, just as far as my experience with my patients in clinic. And I think that's very real. I think, pregnant women are faced with decisions every day about, are they doing the best thing for themselves and doing the best thing for their baby? And I think that's where a lot of this hesitancy has come from. And, questions about the data and, the long-term effects of the vaccine. And so in those conversations that I've been having with my patients daily, especially now that recommendation is so strong that they get the vaccine, I find that answering those questions about, what are the risks, how do we know about the safety of this vaccine, are really helping to inform those patients and feeling more comfortable with those decisions. And so I can't tell you how many times I've answered those questions for patients and they walk out of that appointment feeling more confident in their decision that they are doing the best thing to protect themselves and, more importantly, to protect their baby. Because if they don't stay healthy, then they're not going to have a healthy pregnancy and have a healthy child.
And then Dr. Dion, do you have anything to add to Alan's questions?
Yeah, so we can tell from the CDC data that about 1 in 5 pregnant women has received the vaccine. So really a long ways to go to get up where we want to be. I do think that full authorization of the mRNA vaccine will help some people. Some people are on the fence because of the EUA, but I'm not convinced that it's going to be a huge rush once the final approval is in. I do think it makes it easier for universities and workplaces to mandate vaccination when it's not under an EUA from a legal point of view. And I know some people are waiting for that. I'm just not sure. We'll see how many people it makes a difference for. As for why it's taking so long, it is $1 million question right now. I know that the FDA has had the data for several weeks now and they're reviewing it, and we expected it to be out by now. I don't have an inside story about why it's taking so long, but we're waiting anxiously every day for this approval to come.
And on monoclonal antibodies, how critical is that for, particularly now, getting people out of the ER and out of the hospitals, of getting that going immediately as soon as you come down with COVID and making a difference? And I take it would be available for pregnant women, wouldn't it?
It is. So the monoclonal antibody therapy is therapy from someone who's had COVID with the antibodies, therapy that's created with these antibodies to protect someone who has COVID, to prevent them from going from moderate disease to severe disease or being in the hospital. The studies show it's very effective at keeping people out of the hospital when they have other comorbidities. Pregnancy is listed as one of those comorbidities. So it's the other things you would expect: age, obesity, other medical comorbidities. Pregnancy is definitely included. So the goal is for those people, once they're diagnosed with COVID, to get them into this infusion clinic where they can have the antibodies to keep them out of the hospital. It doesn't work for everybody, but we're trying to ramp up the access to people, including pregnant women, so they can get access to it if they need it.
All right, thank you. Lauren, do you want to ask your question?
Yes, thank you. Can you talk about, during the delivery experience, how different it is right now compared to before the pandemic, whether it means, the women maybe not be able to walk the halls like normal, or the visitor policy, but just how different is the delivery experience right now for women during this surge?
I can actually answer this. I delivered a baby I delivered a baby during COVID, both at UAB. So with my first child, I was able to walk the halls with my husband. We went up and down. People could come in and out of the room very easily. Both my parents and my in-laws popped in to say hello prior to active labor. Actually, my parents hung out with me for a lot of the time. My husband got to, was very involved. I got to eat and drink freely, with clear fluids and all this stuff. It was very straightforward and a very pleasant experience. This time around, while my husband could still be there, no family could come. So no grandparents were allowed. My son could not come meet his brother. I labored with a mask on. My husband had to keep a mask on. I have done both of my deliveries have been unmedicated deliveries. So like breathing exercises are really important to get through a non-epidural and otherwise unmedicated delivery. And that's not as fun with a mask on as it would be with a mask off. Although I did it anyway. Also, when you're in the hospital, there was no ability for like my parents to come in and see us, drop off food, and help out. Or if my husband had to run home and take care of our other child, it wasn't like I could have 3 or 4 backup people there to make sure that there was food things or someone to keep an eye on the baby so that I could take a nap. It was a bit more isolating this time, even though I know that my delivery in 2021 was far different than what deliveries in 2020 looked like, and continued to kind of evolve too. So it was definitely a different experience. I would have loved to have been able to have my family there, have my son come in and meet his little brother. So.
All right, thank you. I'm going to get a few questions from the chat, and then Miranda, I'm going to come to you. So this is from Micah, and I think this might be good for either Dr. Dion or Dr. Williams. Maybe start with Dr. Dion. How can you know if the vaccine is safe, for instance, in utero? There are no long-term studies on effects. And I'd like to add to that with another submitted question. Same thing, how do we know that there's no kind of long-term effects on fertility when hasn't been any long-term studies?
So we have had vaccine available now since December, and the studies of 40,000 people were started before then. So we are beginning to accumulate longer term data on vaccine safety. And these people are followed over years to see what happens to them, whether or not they get COVID after 6 months, 12 months, 18 months. So those studies will give us more information, including women who got vaccinated during pregnancy. How do their babies do? We want to do those studies. Those studies are ongoing. I think it's really important when you're thinking about vaccine side effects to know that the vaccine side effects are connected to when side effects from vaccines, usually within 24 to 48 hours, occasionally within the first 3 to 5 days, a small percentage within the first 14 days, but really basically 0 vaccine side effects after 8 weeks. It would be not consistent with all the rest of the vaccine data we have accumulated over decades to see a long-term unexpected vaccine side effect after years in someone who had been vaccinated in the past. It just doesn't fit with everything that we know about vaccines. This question of infertility has continued to come up. I'm on the American Society of Reproductive Medicine COVID-19 task force, and we've been very clear for a long time now, saying there is 0 evidence that the vaccine is linked to infertility. That is a pernicious rumor that's out there. I hear it in the work that I do in Africa. I hear it with the patients I take care of here in Birmingham. So we need to be really clear on this point. No association there, no data showing that that's the case.
Thank you. And Dr. Williams, did you have anything to add to that?
Nope.
All righty. And kind of on the same line of thought, what makes the COVID-19 vaccine different from other vaccines that they do allow for pregnant women to get?
I think what's different is this is a new pandemic. It's a new virus that we've never seen before. The mRNA technology is a new technology that we hadn't used. So clearly you would not give an unstudied vaccine to a pregnant woman Millions and millions of dollars have been invested in doing these trials in adults and now pregnant women included in some of the studies. So we're no longer in a place where we don't have data. We have clear data in pregnant women of the safety of the vaccine. And again, balanced against that is the risk if you do come down with COVID-19 and all the short and long-term outcomes of infection that we know are devastating, and really more data every day, like Dr. Williams was mentioning about the risk of infection in pregnancy, both to the pregnant woman and to the baby. That balance is not equivalent. The risks of infection are far, far greater. And unfortunately in Alabama, because we have a 25% test positivity rate up from 3% just a few weeks ago, when you go to the grocery store, when you go to the post office, when you're going to work, your likelihood of coming in contact with this virus is still very, very high.
Thank you. Miranda, would you like to ask a question?
Yeah, thank you. So I guess, following back up with the conversation about infertility, you see misinformation about it all the time on social media. We had lots of listener questions coming in about that. Can you just kind of clarify where the rumor got started? Tell us about the research, more about the research that supports that it is in fact a rumor. I think that would be super helpful for our listeners. Thanks.
Yeah, so unfortunately, when rumors start, it's always difficult to know exactly where they started or what the idea was. It's almost like someone has an idea. We've heard concerns about infertility with other types of vaccines, HPV vaccine, for example. So it's something that anti-vax groups have attached to vaccines in the past. And I think that early on it was cited not with any data at all. And, when you see these Facebook posts, they're not scientific studies. It's someone somewhere saying something which is shocking and surprising, and it spreads like wildfire. So really our job is to say that we believe in evidence-based medicine, that we give practice recommendations to our patients based on what the data tells us. And if there is not an association in the data linking these two things, then it's absolutely false for it to be perpetuated on social media. There was a scientist early on who was talking about some of the receptors on the placenta and making a link between the risk in pregnancy of the vaccine and the receptor on the placenta. And that is an example of the receptor being entirely different from the COVID receptor, entirely different from what he was talking about, almost a willful pseudoscientific explanation for a side effect and a problem in a pregnant woman that is not the case. If you work in placental pathology and you understand immunology, you can pick apart that lie at the beginning because there's no basis in it. For infertility, what we have at this point for studies is we have studies of people who are trying to conceive, many of them in these infertility clinics, receiving vaccine and not receiving vaccine, and seeing that there's no difference in the numbers of women who become pregnant with the infertility treatment, the number of successful live births with the fertility treatment, whether or not you get vaccine, no differences in those two groups. And studies looking at sperm and studies looking at eggs, trying to understand if there's an impact on that level of reproduction. And there is some evidence that COVID-19 can sometimes impact sperm. But again, we're talking about the virus. The effects of the virus are always worse and measurable in many of these studies, but no link at all between the pathophysiology of infertility and the COVID vaccine interrupting that. If anything, it's strongly recommended, and we're working on updated guidance now for this group, that if you're undergoing infertility workup, you should absolutely be vaccinated. This is the time to be vaccinated, like Dr. Williams said, before you're even pregnant. Use the opportunity now to get both doses, for your partner to get both doses, to have that experience when you're pregnant and after the pregnancy, like we've been talking about on the panel today.
All right, thank you. Dr. Williams, we are still getting some questions, just, people worried about miscarriages tied to the vaccine or infertility. What do you say to a patient who's anxious about pregnancy? And then kind of a follow-up, have you seen any patients that have had miscarriages after having COVID-19? And have you seen women who have gotten pregnant after receiving the vaccination?
Yeah, so to the first point, when patients come in with those concerns, I really tie it back to exactly the things that Dr. Dion was talking about, that we don't have any scientifically plausible reason that this vaccine would cause any problems with fertility. And again, they have done studies now that have come out that we have been able to follow those miscarriage rates in early pregnancy after people have been vaccinated, and there is no different. Yes, there is a baseline risk of miscarriage for any pregnancy, whether that person has been vaccinated or not. The key is looking at, is there a significant difference in the groups of women that have been vaccinated versus those that have not? And we just haven't seen those differences. So we cannot attribute any risk of miscarriage to the vaccine.
All right, thank you. The second part, more on, have you, I guess, seen anyone who maybe had COVID and then had a miscarriage after? And then also, have you seen someone get pregnant after receiving the COVID vaccine?
Yeah, I mean, because of just taking care of a large volume of pregnant women, I'm sure that I have seen a patient that has had a miscarriage. About 25% of all pregnancies will end in miscarriage, unfortunately. But again, there's nothing that would tie any sort of causality to a miscarriage from the COVID-19 infection. And yeah, since we, started vaccinating patients here back in December, I've seen many patients, several of my patients that I'm seeing for new pregnancy visits over the past several months, got their vaccines early on or have been getting their vaccines. And so many people have had successful pregnancies, just like Dr. Grayson, either getting the vaccine before they were pregnant or during their current pregnancy.
And another follow-up, are you aware of any instances of women getting the vaccine and then going into early labor?
No, and I haven't seen any documented looking at kind of overall population studies. No evidence to support that either. The biggest risk is early labor in patients that have COVID-19 infection, or us having to deliver a baby early because of severe COVID infection.
Thank you. Lauren, would you like to ask your question?
Yes, thank you. The graphic you guys showed in the beginning and the numbers with COVID affecting non-vaccinated pregnant women, I'm curious, have any vaccinated pregnant women required hospitalization or ICU because of COVID?
I think what I heard from Dr. Subramanian yesterday on the presentation was that they didn't have anyone in the ICU who'd completed both doses of the vaccine series. They had some who had the first dose and hadn't had time to get the second dose, but there was no one in the ICU who had had both doses. I don't know, Dr. Williams may know more.
Yeah, that's the information that I have. Of all of our pregnant patients in the ICU, none of them have been fully vaccinated.
All right, thank you. And just for a quick tidbit for everyone, we did get information that almost 250 women who were COVID positive have given birth at UAB Hospital. And then Miranda, do you have another question?
Yes, thank you. I will always have more questions, but I appreciate it. Okay, so going back to, a part of our goal as a journalist is to kind of break down the jargon for people who don't understand, don't have the knowledge, don't have the basis, can't even look at scientific studies and understand what's going on, right? So can you explain a little bit more? I know that there have been many other stories about this. I know that there's been been research on this, but can you talk a little bit more about the immunity of the vaccine being passed on to a baby? Does it happen through breastfeeding, maybe the placenta? How does that work? So immunity through the vaccine versus immunity through the mother having COVID. That would be super helpful.
I can talk about it too, but maybe Dr. Williams, do you take that? It's up to you. I can. So what the studies do, so let's start with vaccination. There's a very nice study from the Edlow lab at Harvard. And what they did is they looked at women who were vaccinated at different time points in their pregnancy, and then looked at the amount of antibody that was crossing the placenta, recognized in the cord blood, and measured in the infant. So what they could tell is what we know. It takes some time for the antibodies to develop in your body after vaccination. So it's better to have vaccination earlier in pregnancy. The women who had 2 doses of vaccination before they delivered had higher levels of antibody, but it clearly crossed the placenta. They were able to measure these very specific neutralizing antibodies, meaning antibodies that actually clear the virus from the body, pass from the mom to the baby through the placenta, and detectable in the baby. So this is exactly the type of irrefutable proof without understanding what all the science, not having to, these studies are complicated. So I think it's not expected for someone to be able to understand and read these studies, but this shows clear evidence of the antibody passing from the mom to the baby and the baby being protected again during this period when we don't have vaccination for newborns. They also followed it up with a study of breastfeeding. So women who had been vaccinated and then were breastfeeding, could they measure the antibodies in the breast milk? And could they measure those antibodies in the baby that was breastfed? And the answer was yes on both counts. So usually the amount of antibody in the breast milk is lower than that in the blood, but some of that antibody level did pass to the baby. We have to do more studies, or they need to do more studies to see how long that protection lasts in the baby. And does that protect the baby from COVID-19 over the first days, weeks, months? We don't know the answer to that yet. Those studies are ongoing. But yes, women who want to be vaccinated, not just for themselves, but for their baby, have good scientific reason to do that now. The question we get all the time is the latter one that you asked. Why be vaccinated if I already had COVID-19, right? The infection itself does give you antibodies, and it's true it does. But when you compare people who were vaccinated versus the ones who had COVID-19, believe it or not, the vaccinated people have higher antibody levels than the people who had COVID-19. When you have COVID-19, your antibodies have a lot to do with how sick you are. So if you didn't get very sick, you had a mild illness, or maybe you didn't even know you had COVID-19, your antibody levels tend to be lower than someone who was very, very sick with COVID-19. And those antibodies don't seem to last as long. So the ones that we care about, which is the antibody to the spike protein, the way that this virus attaches to cells and gets in the body, specifically induced by the vaccines, is the antibody that's higher levels with vaccination than disease. So just to be really clear on the take-home point for the public, it is recommended to be vaccinated even if you had COVID-19 in 2020, 2021, or even just a few months ago. There's no waiting period. If you've had COVID-19 and you're feeling better, you can be vaccinated and should be vaccinated now.
Thank you. That's very, very helpful.
Mm-hmm. All right, we've got another question. This is probably going to be best for Dr. Williams to start out. So this is from Morgan. We're hearing a lot of spouses not in agreement over getting the vaccine. What sort of risk does an unvaccinated spouse pose to their pregnant wife? How can you convince them to get the vaccine?
Yeah, that's a great question. I think that, an unvaccinated spouse is certainly putting their pregnant partner at risk by being at higher risk of contracting COVID-19, shedding that virus that we know could potentially make that pregnant partner much more ill. And so I think it is important to have those conversations with your healthcare provider. Currently we are still allowing a care partner to come to outpatient appointments. So that would be the perfect time for a pregnant patient and her partner to come in and ask those questions, address the concerns that the unvaccinated partner may have. But I think that the evidence is really there that pregnant women are getting very sick with this Delta variant. And so, it's part of shared decision-making, part of partnership. I would highly encourage a partner to be vaccinated as well to reduce the whole family's risk of being exposed.
And another follow-up to that, we all know that pregnant women often face a lot of outside pressure and criticism. What would you say to those women who maybe they do want to get the vaccine for their health and their baby's health, but are hesitant due to pressure or even shame not to, either from family, from friends, from colleague, just from social media, anything like that?
Yeah, absolutely. And this is something I talk to my patients about, in lots of contexts, that there's a lot of unsolicited advice that's given to pregnant women. And so it's important for them to really focus on the things that are important for them and kind of set their own values for what is important for their health, for their baby's health. So I really do think it's important to have those conversations. You know, you trust your healthcare provider to deliver your baby, you trust them when you get sick, trust them to have this conversation too, and trust that we are really looking at the data. We wouldn't recommend something that we didn't believe in, that we didn't think was safe for a pregnant woman and her baby. So I do think that there is a lot of pressure. And like I said, I think that there's always this thought, am I doing the absolute best thing for the baby that I'm carrying? And I think ultimately, you know, the risk of COVID are so high, the risk of that severe disease for our pregnant patients and having really severe long-term outcomes for both the patient and the baby far outweigh what we previously said as potential risk, but now we have more hard data that says that those risks just aren't there as far as the risk of the vaccine. And so I really encourage them to make that decision for themselves.
All right, thank you. Miranda, did you have another question?
Yes. So, you know, we've talked about infertility. Can we talk about, we've talked a little bit about side effects, but, you know, some of the questions that have come up from our listeners have been about menstrual cycles and the effects of the vaccine on menstrual cycles. I feel like that's kind of an area that not a lot of people have talked about in previous reporting. So if you could kind of just clarify that and if there are effects on the menstrual cycle.
Absolutely. I think from kind of this conversation came up really anecdotally, a lot of patients reporting that, you know, they had either skipped a menstrual cycle or their cycle came early around the time of the COVID vaccine. Thus far, there's really only been one study that's looked at this, and that was a study that had women track their cycles kind of around the time of receiving their vaccination and after, and that did not show that there was any difference in menstrual irregularities in women that had been vaccinated versus unvaccinated. And so right now we don't have any data that supports the idea that vaccination is causing any sort of menstrual irregularities. It's also important to remember that the menstrual cycle can be affected by a variety of things. Stress is one of those things that's very high at the top of that list. So even just living in a pandemic, living with a lot of anxiety, that is something that can affect a woman's menstrual cycle. And so I don't necessarily think it's something we can contribute to the vaccine itself.
Most definitely. Thank you so much for clearing that up. And Hannah, if I can I have one more quick question?
Yes.
Okay, awesome. So it's kind of a two-parter. The first one goes back to getting the vaccine. Some people fearing that if they get the vaccine too early in a pregnancy, that it could have developmental issues for their child. If you could talk a little bit more about that, whether that's a thing or not a thing, if we should even be concerned about that, why or why not, the research behind it. And then also, you know, just anything as a journalist we can clear up for the public because there's a lot of misinformation going around. So that would be very helpful. Thank you so much.
And I think to the first point, you know, again, we don't have any evidence that, you know, there would be any sort of long-term developmental adverse outcomes from the vaccine. As Dr. Dion mentioned, there is no vaccine where there has been adverse effects within that, you know, first 8-week period. And so we wouldn't expect this vaccine to act any differently. Of course, we're continuing to collect that data. So that's why it's important if our patients are vaccinated and are approached about participating in a study, we definitely encourage them because we want to collect all that information so that we do have that data long-term. But there is nothing to suggest right now that there would be any sort of developmental adverse effects from the vaccine.
Just to add to that, I think the problem with waiting is sometimes you wait too long without realizing it. So because we have these 2-dose mRNA schedules, you need 3 weeks for that second dose. And as I mentioned, you're really ideally protected 2 weeks after that second dose is done. So if you're waiting until 30 weeks, let's say, and then that 5 weeks passes and you happen to have your water break early, you have been potentially exposed during that first and second trimester, but also not really giving your body time to make the antibodies to protect you ideally by the time that you deliver. There are some things that are unpredictable about pregnancy. So that's part of the reason why the recommendation is to do it as early as possible, especially with these really high circulating community rates.
Yeah, and just to kind of piggyback off of that as well, I had a patient that I just had a telemedicine visit with the other day that I'd been talking to at her last several appointments, encouraging her to get vaccinated. And she ultimately decided to get the vaccine. She had made her appointment, but then went to an indoor gathering with some family and contracted COVID before she was able to get the vaccine. And just talking to her a few days ago, I could really hear that. And she even told me, she's like, gosh, I wish I had just gotten that vaccine sooner. Even though she's had a fairly mild case of COVID, she has still been symptomatic. And she said, I wouldn't wish this upon anybody. So I think really the sooner the better for not just our pregnant patients, but for everybody. Don't wait to get the vaccine.
All right, thank you. I think we're going to kind of go ahead and wrap up. This is for Dr. Williams, kind of to close. What are you are seeing in person the impact of COVID on pregnant women. What is your final message to a woman and to her partner who thinks she won't get COVID while pregnant, she shouldn't get the COVID vaccine, and they're willing to take the chance? And what about the women who might just be scared?
Yeah, I think that the risk of COVID have really proven to be very detrimental for our pregnant patients. And, as safe as you may be, we've all, have the tendency sometimes to let our guard down. And as Dr. Dion said, our rates in our community are so high right now that you just don't know. Getting groceries, gathering with friends or family, there's a very high risk that you are going to be exposed. And just with that high positivity rate that we're seeing with our pregnant women, I wouldn't want any of my patients to put themselves in that position. So when we have the opportunity to protect ourselves against something, we have to take that opportunity. We didn't necessarily think we'd be back here in another very high peak, another wave at this point. But we have now a really effective tool to help get us out of it. And so for any pregnant patient that's considering the vaccine, I really strongly encourage you to talk to your healthcare provider. We don't want to see you here in our ICUs and having to have your baby delivered early when something that could have been prevented.
All right, thank you. And then Dr. Dion, Dr. Grayson, do you have any closing words?
Dr. Williams said it perfectly. I have nothing to add to that.
I just want to say, from a mom to another mom who's worried and who's been through it, both getting vaccinated and having a baby, the moment you find out you're pregnant, you are the mother of that child. It does not take them entering the world and breathing oxygen for you to be their mom. And you will spend the rest of your life and their lives making the best decisions that to keep them safe. And mom shaming runs rampant, especially with the advent of social media. Shut those people out and listen to your doctor, listen to the physician that you are trusting to help you bring that baby into the world, and know that they are trying to help give you the best advice to keep you and that baby safe. That was what I did. My physician, who I trust very much here, the woman I trusted to help me bring this baby into the world, said, do not pass go. Do not collect $200. Go straight to get your vaccine. It's not worth the risk. So don't put yourself at risk. Don't put your baby at risk. And if you've got other children at home, don't take the risk that you're either very sick and can't help take care of them, or that they grow up without you. It's not fair.
Thank you so much, Dr. Grayson, and to Dr. Dion and Dr. Williams for joining us today. We will be sending a recording of this afterwards, along with the interview we talked about earlier from yesterday, that has more detail on what they are seeing in ICU, as well as the graphics. So thanks everybody for joining, and have a great rest of your day.
And that was a live Q&A session with doctors at UAB Medicine discussing the impacts of the COVID-19 vaccine, the coronavirus pandemic, and pregnancies alongside women's health as far as breastfeeding and fertility. Lots to discuss from that live discussion there just a few moments ago. I do want to remind everybody that there will be a complete recap of this press conference alongside with a full video from all the questions answered, everything that was mentioned in that press conference will be available over on our website, cbs42.com, in just a matter of moments. So you feel free to share it out there, pass it along to anybody who is planning on becoming pregnant or is already pregnant and is having a lot of questions regarding getting the COVID-19 vaccine. This is straight from health officials who deal with pregnancies all day long and have been dealing with the coronavirus pandemic for over a year now. Very quickly, want to alert your attention to the right of your screen. There is once again the COVID-19 dashboard, courtesy of the Alabama Department of Public Health. You can find that at any time over on our website, cbs42.com. There you can find all the latest numbers. Again, the state of Alabama saw more than 3,800 new cases of COVID-19 there in just one day yesterday. As you can see there, the state is outlined right there. 66 out of the 67 counties in the state of Alabama are considered high transmission counties for COVID-19. The one, Choctaw County, being in orange, that means it has a substantially high transmission rate. Very quickly, want to go over some of the key points that were mentioned in this press conference with UAB doctors. Again, we heard from Dr. Audra Williams, Dr. Jessica Grayson, who actually was pregnant and had her child during the pandemic. She said that she received the vaccine and had no adverse effects and had a very normal pregnancy, and her newborn baby is doing very well and meeting all of the checkpoints. Those were the words from Dr. Grayson moments ago. And we also heard from Dr. Jody Dion. She gave a lot of numbers regarding hesitancy among pregnant women. Again, the CDC saying that only 1 in 5 pregnant women are vaccinated for COVID-19. She also mentioned that while we are currently waiting for the FDA to fully approve these vaccines, again, we did get the emergency approval when the vaccine was first released, but to be fully approved, we are still waiting on that. She doesn't believe that the FDA approval will actually help increase the vaccination rate. She says it is really going to come down to making sure people get the right information. So again, I implore you all to, pass this story along, this stream. We are going to have a full recap of this live discussion over on our website, cbs42.com, in a matter of moments. Pass that on to anybody you know who's planning on becoming pregnant or is pregnant, so they can better make a decision for themselves, but get the best information they can from these 3 doctors that we just heard from a moment ago. Again, that will be available over on cbs42.com in a matter of moments, and you can also find it by downloading the CBS 42 News app. It is available for free for all Android and iOS devices, and then you can also receive push alerts and notifications whenever we do have these sort of live discussions with doctors, healthcare officials. Do want to remind everybody that coming up at 4 p.m., the Medical Association of the State of Alabama will also be holding a COVID-19 update discussion. State Health Officer Dr. Scott Harris will be joining them to discuss COVID-19 myths and sort of trying to dispel them and really pass on what we do know and what we know to be true in the healthcare field regarding COVID-19 and the vaccine. That's going to do it for us today here on CBS 42 Now. I want to thank you all for joining us today. I'm Phil Pinarski, and we hope you have a great rest of your day.